What do you know about chlamydia? Today, we're going to delve into this common sexually transmitted infection, or STI, that can impact both men and women. Chlamydia is caused by the bacterium Chlamydia trachomatis. It's a sneaky infection, often easily treated yet potentially causing serious permanent damage if it slips under the radar. As we navigate through this topic, we'll uncover its many facets from symptoms to prevention. Now that you have a general idea of what chlamydia is, let's move on to its symptoms. How would you know if you have chlamydia? This silent invader often goes unnoticed due to its ability to hide behind a lack of symptoms. However, when symptoms do make their uninvited appearance, they can range from pain while urinating, a dull ache or discomfort in the lower abdomen, to an unusual discharge from the vagina in women or the penis in men. For women, the symptoms may also extend to pain during sexual intercourse. On the other hand, men might experience an unusual testicular pain. It's important to remember these symptoms might not always be present, or might be easily dismissed as something less serious. Yet, chlamydia can lead to severe health complications if left untreated. So if you're feeling off, if something just doesn't seem right, don't brush it off. Pay attention to your body. It's trying to tell you something. If you're experiencing any of these symptoms, it's critical to get tested. So, how can you get tested for chlamydia, you might be wondering? Well, there are generally two methods. The first is a urine test, which is as straightforward as it sounds. All that's required is a simple urine sample that you'll provide at your healthcare provider's office. The second method involves a swab of the affected area. This could be the throat, rectum, or for women, the cervix. Now, it's important to remember that if you're sexually active and you've noticed any unusual symptoms, it's highly recommended to get tested. You see, chlamydia is often known as a silent infection because it doesn't always cause symptoms, but it can still be harmful if left untreated. Getting tested is a key step in taking control of your health. It's a simple, quick process that could save you a lot of worry down the line. Once you've been tested, and if you've been diagnosed with chlamydia, what's next? Stay tuned to find out. What happens after a chlamydia diagnosis? After the initial shock subsides, it's time to focus on treatment. The good news is chlamydia is a bacterial infection, and like many bacterial infections, it can be effectively treated with antibiotics. Treatment usually involves a course of antibiotics prescribed by a healthcare professional. The most commonly used antibiotics are azithromycin and doxycycline. It's crucial to follow the prescribed dosage and complete the entire course of medication. Why, you might ask? Well, even if your symptoms vanish before you've finished your medication, it doesn't necessarily mean the infection has been completely eliminated from your body. Skipping doses or not completing the course can lead to the bacteria becoming resistant to antibiotics, making the infection harder to treat in the future. So, always remember to take all prescribed medication as directed by your healthcare provider. Treatment is only half the battle. Let's talk about how to prevent chlamydia. How can you prevent getting or spreading chlamydia, you might ask? Well, the answer isn't as complicated as you might think. Firstly, it's essential to use protection during any sexual activity. This means using condoms correctly every single time you have sex, whether it's vaginal, anal, or oral. Condoms act as a barrier, reducing the risk of transmission not only of chlamydia, but of other sexually transmitted infections as well. Next, consider limiting the number of sexual partners you have. The more partners you have, the higher your risk of exposure to chlamydia and other STIs. It's all about playing it safe and being mindful of your actions. But even with these precautions, it's still possible to contract chlamydia. That's why regular STI screenings are crucial in prevention. These tests can detect chlamydia before it causes significant health problems and can prevent you from unintentionally spreading the infection to others. If you're sexually active, especially with multiple partners, regular screenings should be a part of your healthcare routine. Lastly, communication is key. Talk to your partners about STIs, their sexual history, and the last time they were tested. Open and honest discussions can help ensure the health and safety of everyone involved. Remember, knowledge is power. Stay informed, stay safe. Our health is in our hands, and by being proactive, we can prevent the spread of chlamydia and maintain our well-being.